Hello, nice to see you all again. It's been really nice to be at one of these conferences and get to sit at the back. So if parent participation in health had an annual health check, what would it say? Well, I think that the report would probably say that increased activity would be beneficial to the health and well-being of all those involved. We know that, as Anne said earlier, that some forums are working with their clinical commissioning groups and that progress is being made, and that's been shown in the response from the SENS surveys that we had. So we know that some progress is being made in this area, but actually only 22% of forums feel that local health partners are either extremely or well engaged in the delivery and the implementation of the SEND reforms. And 19% of forums who don't know how well health is engaging in the SEND reforms, which I think is a little bit worrying. We've also had really clear and consistent feedback from forums that there is real concerns about the specific lack of quality advice available for education, health and care plans around health. So, that's some pretty strong messages out there from forums. But the good news is that these messages have been heard at a national level and that things are starting to be put in place to actually address that. So the first thing that is something that hopefully you all know about, and that's the project that I'm leading on, which is the Contact a Family Health and SEND project, which is funded by the Department of Education. And that has got a number of aspects to it. One of the main areas is looking at how we can support forums to develop more effective relationships with clinical commissioning groups, as well as producing some resources to help local forums in general and also health practitioners, particularly around writing outcomes for education, health and care plans. So the Contact Family project will look at working with forums in 9 pilot areas throughout England. In these areas, we'll work with the forums to identify what the particular challenges are and what information, training and support the forums need to improve engagement with health. The pilot areas, which are all mentioned up there, were chosen to provide a variety of experience and range of circumstances so that all forums can really benefit from the learning that we gather. So what are the key issues that we're hearing at the moment? I've just been lucky enough to be travelling around the country for the last month, visiting the majority of the pilot areas, which has been a fantastic experience to go and sort of see forums and hear about all the work that they've been doing. And there are some very clear issues that are being raised. So one is about, in general, the lack of understanding amongst CCGs and health partners around participation and co-production. So health does do participation, but not as we know it. It's sort of an arm's length version of participation. And I was interested to hear from our colleagues in the Eastern region. There was a comment about local authorities sometimes being scared about having parent carers in the room. Actually, our health colleagues, in many cases, are petrified about having parent carers in the room. And that's a real sort of challenge to overcome. Yeah, another major challenge is that we know that there's been a huge amount of change in health systems over the last few years. And there is a huge amount of confusion about how health commissioning works locally. And that's not just amongst parent carer forums, but actually amongst our colleagues in the local authorities as well. One forum said to me, practitioners don't know what they can offer and parents don't know what they're entitled to. And also we've had a huge amount of change in terms of personnel. So there's often a really unclear chain of command for health decision making locally, with people not really knowing who's responsible for what. There is also, and I was really pleased again to hear from our colleagues in the Eastern region talk about the Joint Strategic Needs Analysis, which is a really key document, and particularly for health as well as local authorities. But there hasn't been the same sort of opportunities for forums to engage in influencing clinical commissioning operations plans, or maybe the health and wellbeing strategy as ideally there would have been. And often, as with the JSNA, children and young people with SEND are frequently not mentioned in these documents at all, and actually other groups such as maybe the elderly are actually dominating these plans. So I think it's really important that we start thinking about how we can use those plans as levers. Feedback does show that forums are being successful with working with practitioners and often individual services and making a real difference there, but we need to look at about how forums can really work at a strategic level. So the next step is sort of what can we do about improving and addressing some of those challenges, and that's what I'll be working with colleagues, with the forums in the pilot areas to address. How can we respond to those documents? How can we use them as levers, and improving our confidence and our knowledge about the health system and how we work with it. One thing I do want to say is that there is a very clear message from the pilot areas that one of the really important factors for success in terms of forums' relationships with the local authorities has been the very clear direction that's been given from the DFE and other national bodies about the need for local authorities to work with forums. That message hasn't been as strong in health, so we need to look at how we can change that. And this is where another piece of good news hopefully comes in, that a new board has been set up, the Children with Complex Health Needs Implementation Board, which met for the first time in July. It's got a real range of people round the table, so actually for the first time when discussing health issues, we've got representatives from NHS England, the Department of Health, the Department for Education, the voluntary sector clinical commissioning groups, health providers and parent-carer representatives sitting around the same team. As I'm sure you can imagine, that makes for quite an interesting meeting. There are a number of purpose and priorities that board has, but the one that I really want to share with you is that it has a priority, it has a stated aim to ensure the timely implementation of the SEND reforms by CCGs and oversee the SEND priorities agreed by the board. And ensure that actually happens. So I'm sure that would be welcomed by everybody in the room. There's also other priorities about ensuring people work together and clarity of information and signposting CCGs into how to implement the SEND reforms. And myself and colleagues from the NNPCF sit around that board. You probably wouldn't think it, but there are other things happening other than the SEND reforms. So hopefully all of you have received information about some work we've been doing to try and increase the number of young people on the GP's Learning Disability Register. We know there is a real lack of good quality information about young people with disabilities or additional need, and because of that they miss out on services. So this is one of the things we're trying to do to address that. Another thing about sharing information, which is another key issue, is the summary care records, which have been ongoing for a number of years, but are now at a stage where they're looking to put additional information on those that could really enhance the quality of care that young people experience, particularly in emergency or urgent care situations. So if you want to know more about those, have a look at the links that are included. The one sort of thought that I did want to leave you with was is about the need to persevere. I know that you've all been working really hard for a very long time, and that with health it doesn't feel as though we're getting very far, but I do believe that things are starting to change, and we really need to be ready to make the most of the opportunities that will be presented. Thank you very much.